The morning show here on Arise News. The World Health Organization acknowledged COVID-19 as a public health emergency of international concern on January the 30th, 2020, and characterized it as a pandemic on March 11, 2020. Africa experienced its first case on February the 14th, 2020, with Nigeria recording our index case the same month and entering the community transmission phase within a few weeks of its onset. Today, Nigeria has recorded almost 53,000 COVID-19 cases from about 384,000 tested samples and 1,007 deaths, a case fatality rate of 2%. The country is still in the first phase of its response to the virus, comprising an initial total lockdown and a partial or eased lockdown thereafter. The intention during this phase was to flatten the rate at which COVID-19 infection spread, buy time for the government to improve the capacity of the health system, and improve the readiness to deal with the anticipated full impact of the epidemic. With all of this implemented, where then is Nigeria at the moment? What are the gains and the challenges? Also, a number of key stakeholders in the private sector have also been offering much needed assistance in this respect. And among the very first institutions to heed this national clarion call is Chairman and Editor-in-Chief This Day Media Group and Arise News Channel, Nduka Obaibena, who made available the This Day Dome facility in Abuja to provide a 500-bed isolation center, which can potentially be expanded to retain up to 1,000 patients. Let's take a look at 6 months ago when this very important facility was donated to this cause.
A new dawn for This Day began with the handing over of its self-titled Dome Testing, Tracing and Treatment Center in Abuja.
We are ready, willing, able and available to work with the federal government, as all Nigerians are, to defeat this pandemic.
The effort was also powered by energy conglomerate Sahara Group.
What started off as a little plant has now grown to be a forest. As you would see later, you would see the COVID mobile lab, the hotels, etc. So for us, we started with something small, but it's grown to be something much bigger. But we are overwhelmed and happy to be part of this.
So too was it supported by a group of entities including the Nigerian National Petroleum Corporation, China Civil Engineering Construction Corporation, and the Central Bank of Nigeria. And that's not all. An app for COVID-19 contact tracing was also launched. A stone's throw away, a 98-bed hotel has also been donated for medical staff to stay in for 6 months.
It has shown how great Nigerians are. We've all come together to fight the common enemy, COVID-19. And by the grace of God, it will come and pass.
This day also joined forces with 54Gene to create a mobile testing center. 200 tests can be done in a day, and that could soon be ramped up to 1,000 tests daily. 54Gene's leader says the time has come for more investment into scientific research in Nigeria.
For the first time in a very long time, everyone in this country knows the name of a disease and is speaking that disease at the same time. And everyone is talking about antibody-based tests, antigen-based tests, PCR-based tests, things that would have never been in the lingua of most people. So I do think that this may, and I say may because it really depends on how it's executed, this may be the opportunity for Nigeria to stop paying lip service to molecular sciences and actually start executing and actually start investing in education, actually start investing in healthcare. We've seen how our hospitals are not well equipped, right? And so there is now a lot of attention in the healthcare sector and in the science sector, not just in Nigeria, globally. And I hope that that becomes one of the positives from COVID-19, because it made us as a country begin to build the infrastructure we need for the future.
Nigerian Health Minister Dr. Osagie Ehanire has commended the donations, describing them as a landmark collaboration between the public and private sectors.
He has always been to strive for the best and prepare for the worst. We are striving to have the best outcomes and also preparing for the worst. So this edifice you see right here is serving that purpose of being able to help us prepare for the very worst. And we are particularly grateful that it's an addition to the assets we have on ground.
With the closing of the last speech, the delegation, in groups of 5 people at a time, began a tour of this day dome so they could take a closer look at the facilities. The treatment centre is fitted with foundation wards and an intensive care unit complete with ventilators, X-ray and dialysis machines. Well, inside this day dome, there are more than 270 beds available. Spread across 2 floors, there are also treatment and equipment rooms, all boosting the effort to administer quality care when the need arises. In this process, this former theatre has been transformed into a quality part of the arsenal needed in the country's fight against the spread of the COVID-19 virus. Adefemi Akinsanya, Arise News, Abuja.
Joining us now to look at all of this is Dr. Alero Roberts, Senior Lecturer at the Department of Community Health and Primary Care, College of Medicine, University of Lagos. She will also be talking to us about the eradication of white polio from Africa, and particularly Nigeria. Welcome to the program, Dr. Roberts. Good morning.
Good morning. Thank you very much for having me.
Yes, it's good to have you again on the morning show. Well, quickly, 6 months since the first index case of COVID-19 was reported in Nigeria. In your own assessment, how have we fared since then, 6 months later, both at the federal level and at the state levels? And what's your assessment of the interventions, the responses, and what would you like to see going forward?
That's a fantastic question. And how have we fared in the last 6 months? I would say I'm a teacher. So where the world expected us to score somewhere between 40 and 45%, we scored well above 90%. And in true teacher fashion, I'm going to say there's room for improvement, because if you can get as far as 90%, go the whole hog. Let's aim for 100%. The fact of the matter is the numbers do speak for themselves. And sad though that it is that we have lost a little over 1,000 lives, the fact of the matter is that in 6 months, that's all that we have lost in a country of 200 million people. A lot more people have died from other causes, but not from COVID. And there's a lot to be said for how that has come about. We do know, those of us in the medical profession do know, that this was a country, our country was ready as any country could be for this. Despite the fact that we have limited resources, we had deployed these resources quite creditably to the areas where they were needed. And this is something that we must say has worked in our favor. We must commend the administration. We must commend the very high-level political commitment that we have had at the federal and state level, particularly at the state level, I must say. Lagos State has really benefited from successive administrations that have put the health sector front and center in the administrative policies.
Well, we've seen uncommon solidarity since this pandemic began. I mean, Taiwan donating masks to Europe and the US, Cuba sending doctors to Italy. We are seeing even the best of healthcare countries building, temporary shelters and temporary hospitals, including here in Nigeria. What would you say has been most outstanding for you in the national response 6 months after?
What has been most outstanding for me personally, for me as a physician, and for me as a team of physicians and healthcare workers at the primary care level has been the responsiveness of the administration. You know, almost literally everything that is needed there has been committed attempt to supply, and that is absolutely amazing. From the Commissioner of Health, from the state, His Excellency, the state governor, you know, at the federal level, the Federal Minister of Health, that responsiveness is actually is actually very, very commendable. Have we got everything we needed? No, we haven't. But we have to remember that this was a global pandemic. When we compare it to something like the polio eradication, where the entire world was concentrating its resources on 3 countries, in this case, the entire world is battling with this disease in real time in their countries at the same time. So we haven't got everything we needed, but it has been a very commendable that the responsiveness and the attempt to deliver on all the things that are needed is to be commended very highly.
Well, Dr. Roberts, I read a statement on COVID-19 in Nigeria yesterday, released by the ANAP Foundation. The ANAP Foundation is a think tank on COVID-19, established by Mr. Atedo Peterside. And in the occasional paper O2, titled, as COVID-19 enters a new phase in Nigeria. There is an argument there in the assessment, in the considerations, that there is what appears to be creeping complacency on the part of governments in Nigeria. But after doing a situational analysis, in section C of that paper, ANAP Foundation then goes ahead to make a number of recommendations. One of the major recommendations that body is making is that there should be a full reopening of the economy. And the argument, the sub-argument is that, well, given the GDP figures that we have seen, with the economy contracting by 6.1%, it will be counterproductive. It will amount to double jeopardy to continue to lock up the economy. When we see that across Africa, as you said, we've done relatively better. And even in Nigeria, as you said earlier. Do you agree with this? There are other recommendations in that report, but I think the key one is about full reopening. They even went further to say if there is still any curfew anywhere, the curfew should be cancelled so that there could be economic activity, and Nigerians, will just need to be better mobilized to observe the guidelines with regard to barriers, with regard to relationships. They say that's the way forward in that foundation. What are your thoughts?
Well, you can trust that immediately we leave this place, I'm going to look for that paper and read it up. But to a large extent, I am in agreement. I mean, it is clearly evident that, what we hoped to achieve by distancing and separating people and locking people down was, well, we have achieved the extent to which we can achieve, and that is the truth. One of the things that I noticed yesterday, because I needed to get into the market, and I'd actually gone to the market on Tuesday only to discover, to my shock and chagrin, that the market wasn't open. It was only going to be open on Monday, Wednesdays, and Fridays. And then I thought to myself, what's actually happening here is that if you have, say, 10,000 people going to the market 5 days a week, that's 2,000 people going to the market a day. What they have now ended up doing is concentrating all of those 10,000 people into just 3 days a week, meaning that we've got double the numbers now crowded into the same space 3 days a week. It actually doesn't make public health sense, and it certainly no longer makes economic sense. And because the attack of this virus in our economy, in our area, has been more on the economy than on the people, I think there is a huge argument to be made for reopening the economy, because one of the things that is clearly evident is that if we have a large proportion of the population who live from hand to mouth, who have to go out every day to make a little bit of money in order to eat, one of the things that's going to happen is that they are going to go out every day to make that money. And if we don't make it possible for them to make that money easily, then we are going to further expose them to the risk of the disease. Whereas, like the paper suggests, which, to quote what you're saying, what the paper suggests is that it's better to mobilize them and to empower them and to incentivize them to maintain the public health guidelines of keeping a distance and wearing a face mask and washing hands more frequently and using a hand sanitizer when you can't wash your hands. I mean, these are the things that we need to concentrate on, because until the economy recovers and begins to recover fully, we're going to have problems of people dying of other causes, not necessarily COVID, but dying of other causes that we say are poverty-related.
But considering that enforcement of the protocols has been a great challenge in this fight, would that be a wise decision to open up the economy? When you look at countries that have, to a great extent, brought the pandemic under control, they're now beginning to record second, third, and fourth waves, depending on the country you're looking at. We're still battling with a first wave. We don't even know when we're going to peak. So how wise would that decision be?
What alternative do we have, sincerely? What alternative do we have? And these are the things that we need to consider. If we are working for the good of the people, first of all, you have to understand where the majority of the people really are. I mean, we're not talking about the elite and the comfortables who can self-isolate in 7-bedroom mansions and have the luxury of space between their the gate of the compound and the house. We're talking that the majority of the people are living in situations where the concept of self-isolation is an oxymoron. So we have to work for the good of the people at the level at which they expect that work to take place. So unfortunately or fortunately, if holding back the economy and keeping curfews in place and restricting the opening of, income-generating activities is going to harm the people, then you weigh the pros and cons. Will COVID kill more people than shutting down the economy is doing? These are the things that we need to look at. And one of the things that we have succeeded in doing in Lagos State, and I'm sure it can be easily replicated across the country, is that we have flattened the curve as per the burden on health facilities. I mean, in Lagos State, we're looking at shutting down some isolation centers because they are underutilized. What we need to do is to redistribute the health services available amongst the people who need them the most, and that is at the primary health care level. We are having an uptick in the number of women who do not get effective antenatal care, who are not getting safe deliveries, an uptick in the number of babies who are not being immunized. That's not good. That's not good. And if opening the economy is going to reduce those numbers, then I'm all for it.
Well, Dr. Roberts, another concern is about the data that we're working with in Nigeria. There are persons who have expressed concern that we're not doing enough testing and that the figures we quote, 53,000, 1,007 deaths, may not really reflect the true situation with regard to COVID-19 in Nigeria. I know that the DG of the Center for Disease Control has talked about partnership with the private sector. And we have seen that example in Lagos State with First Cardiology and also with Redistribution Hospital. But what else do you think government should do to test more so that we can have a more accurate picture of what is going on? Or will you say, like President Trump, that testing is not so important?
Well, certainly not like President Trump, to be honest with you. But the issue is that we need to know how many people have or could have had this virus. And we can use other means if testing is not that easy. And now testing is, as we have said it often enough, is a complicated, very long drawn-out process requiring a lot of consumables and things that make it difficult because we're all competing for these consumables on a global scale. But why can't we do increased surveillance using case definition? That is something that we can do. That is something that we have done. That is something that is proof positive of a strategic a strategy that works. And then we strengthen and increase our surveillance across the primary healthcare level to pick up people who may have had or who have symptoms that are suggestive of COVID. Because right now, the issue is not the number of cases that we're picking up by testing or not picking up by testing. The issue is really the health burden on the health services that are available and how we can make sure that that is not going to increase. Like I said, the danger is that people stay away from the health facilities and people are going underground, and then other things are now causing problems, not necessarily the COVID. So testing is as testing does. But if we cannot ramp up the testing much more than this, then we have proven strategies that we can use to find out what the real numbers are. And you said something that was very important, the data. We have to strengthen our data collection. We have to strengthen our data monitoring. We have to strengthen our data reporting. And testing is not the only thing we have to do. We have to strengthen that. We have to be able to put in place apps and tools and strategies that we can use to get this data and use it to create trends and analyze what is going on so that we can decide what to do.
To sound as if we're dealing with full-fledged pandemic fatigue here. But let me ask you, when you advocate that we should open up the economy, we are hours away from international flights resuming if those protocols are, eventually put in place by the federal government as the date was set for 29th. Would you also advocate that we should open up schools?
You've put me on the spot there, girl. Schools is a very controversial issue. Schools do have to open up because what we have seen is a widening of the gap between the children who do have access to online learning and the children who do not. And one of the things that is definitely critical is that education and health are the twin engines of national development. So schools do have to reopen. What we need to do is make sure that schools can reopen safely. And those are the issues. So just shutting schools down is not in itself a solution. There are all sorts of strategies that can be used in different circumstances. We're doing excellently well with the examination classes right now, maybe because there are fewer numbers in a lot more space. But there's a lot that can be done to make sure that schools can open safely. And it is a huge opportunity, in my consideration, for more private-public sector collaboration for schools to open safely. Because the key thing is that let's not concentrate on schools opening, let's concentrate on children getting an education. And I'm sure by the time you speak to all the educators in the business, there are all sorts of ways that we can use to make sure all children, no matter where they are, no matter what the socioeconomic stratum they belong to is, all children can get access to good education.
Well, Dr. Roberts, I imagine that we'll end this conversation with polio, but very quickly, as quickly as possible. The DG of NAFDAC, the DG of NAFDAC has been talking about chloroquine. That chloroquine, if applied at the early stage of COVID-19, could help, both as a prophylactic and even subsequently as a treatment. But at the later stage is remdesivir that will help, and that the drugs applied will depend on the stage of the illness. What's your reaction to this? Chloroquine, remdesivir, do you think that it was right for the DG to announce this publicly and then maybe ramp up the risk of self-medication?
That is the danger, because for me, the danger is this issue of self-medication. Whether chloroquine or remdesivir are useful in the early or late stages of the disease needs to be backed by research based on well-constructed, ethically approved randomized clinical trials. That was not done. That has not yet been done. That is still being undertaken in a lot of places, in about 4 or 5 centers I know about in Nigeria, but the results are not yet out. We need to be very, very careful, because we do know that we live in a largely health illiterate environment, and health illiteracy is a global thing, not just a Nigerian thing. It's a global thing where people take one little thing that you say and run with it, misinterpret it, misapply it, and there can be very fatal consequences. So in a country that hasn't yet regulated the drug sector, there was a very interesting comment made by the president of the PSN the other day, where he too was actually very sad at some of the comments that had been made that are likely to lead to an increase in unregulated self-medication, dosages not regulated, access not regulated, safety not regulated, toxicity not regulated. Because you cannot just tell people something and then they go and take a drug. We don't know what their underlying health status is. Do they have underlying heart problems and all that and all that? And then they go and use scarce resources to go and take a drug that may have very limited benefits, if at all.
Well said. Well, let's talk about something you're so excited about, polio. We eventually kicked out wild polio from Africa. However, we still have it in Pakistan and Afghanistan. So my first question to you is, could wild polio still return to Nigeria? And secondly, how do we leverage this polio elimination strategy to contain COVID-19, if possible?
Well done, well done, well done, well done, well done, well done, Nigeria, well done, Africa. This has been years. It's been a long journey. We've lost many good people along the way. We've had horrifying stories. And, you know, I've got to give a big shout out to all the healthcare workers at the grassroots level, the health promoters, the health educators, the community development associations, executive and members, people who went out door to door, compound to compound, talking and educating and looking out for and watching out for acute flaccid paralysis. It's been a long journey, and you know, while we remember the big names, we must remember all the unsung, unnamed heroes who have been at the grassroots for this for a very long time. In 2005, we did not think this would ever happen. It looked so bleak and so dire, but with the commitments, and this has been commitment at the very highest levels, to engage everybody in the community, the traditional leaders. Kudos to all of you. You know, the community development associations, health educators, health promoters, community health extension workers, people that, you know, people working in the health service delivery that most of the population don't even know exists. This is something that we can do again. We've done it. And let's forget, it was the polio eradication machinery that we had in place that was of such great benefit to us in 2014 when Ebola hit our shores. I remember clearly the day a particular gentleman, you know, was diverted from going home to his home in Ibadan and sent down the expressway to Lagos to start the Emergency Operations Center protocol in Lagos when the late Sawyer was diagnosed, and how we did that, and it was simply a plug and play. So we have that. It's the same strategy we've used for the emergency COVID-19 response, a plug and play, where these are things that we know work: community engagement from the grassroots up, risk communication strategies, talking to people, convincing people, getting people to work towards a behavior change. We've done it. That's the proof of concept. We are an open experiment. Nigeria is an open experiment that shows that when you put these things in place, it works. You've got the highest level of commitment politically, economically, legally, and then you've got commitment and you've got the work all the way down to the grassroots. That's amazing.
Well, Dr. Roberts, you recall that in 2015, Nigeria was taken off the list, the WHO list of high-risk polio countries. But then that was to be the first step towards declaring us polio-free. But then all of a sudden in 2016, there were cases, fresh cases of polio reported in the northern parts of the country. Even now that the whole of Africa is celebrating that Africa is now polio-free, the WHO Director General, Ghebreyesus, has said there must be no complacency. That we should use the knowledge of how we got to this point to make sure that there is no return to the past. And you know, the way we are in Nigeria, religious reasons, complacency seems to be a way of life. What are those steps that we need to take in Nigeria to make sure that either in the north or in the south, we do not have wide polio cases again?
Well, you are right. In 2016, it was a huge setback when those 3 cases were found in Borno. But at the same time, it was a huge lesson in this issue that you say is complacency. We must be very, very vigilant, and we cannot lower our guard on active or passive surveillance for this and any other disease. Surveillance is the key. We must strengthen our surveillance systems across board. And this means also that we must strengthen our routine immunization and our primary health care. We must strengthen our primary health care. We have to have that at the grassroots level because they are the first line of defense that the country has against any disease, polio, COVID, any disease at all. We must pick it up at the very earliest stage when something can be done about it very, very quickly. the DG WHO is very, very correct. We cannot afford to be complacent. Funnily enough, I hope you realize we're still not being complacent about even something like smallpox. Even though we've eradicated it over 40 years ago, we are still watching out. Everybody is still, in the health sector, people are still on the alert, because we know that any of these things, they could come back. It could be a malicious intent. It could be carelessness. We must be on the lookout, and we must strengthen. So the government still has to help us to make sure that our surveillance systems are improved. I know that now with smart technology, there are all sorts of ways we can do so. There's something that they had trialed as part of the WHO, the polio surveillance system, an app that was given to health workers to report acute flaccid paralysis that worked brilliantly. It's upped our reporting system, and even in areas in Borno that had never reported an AFP by the traditional methods, it reported acute flaccid paralysis. These are things we can leverage on and need to be deployed, and it doesn't cost anything. It's just will and commitment.
And that brings me to the question, why do you think that we've not been able to use such disease eradication control to mitigate some of the other age-long diseases that the world has forgotten about, such as malaria, Lassa fever? What seems to be the problem? I mean, we've done polio. We've done it so good, even though it took this long. Why are we not applying it to other diseases?
Oh dear, you've just let go a major question we ask young medical students. Why is a disease, or why can certain diseases be eradicated and certain diseases not be eradicated? A lot of it has to do with the nature of the disease. Polio is unique, like smallpox. There's no other hosts. Human beings are the only hosts. And then there's a vaccine that is very effective and relatively inexpensive. Not all diseases fit that mold. So something like malaria, we have to get rid of every single mosquito before we can talk. And then, it's such a complex parasite that causes it, that developing the vaccine, although there's been a lot of progress made in developing the vaccine, but, these diseases don't fit so neatly into the eradication mold like polio and smallpox does. So the world is on the lookout, and where there are situations where the disease can be eradicated. So something like COVID, I recall 2 days ago, somebody, I can't remember who it was, who said that if we could, for instance, wear face coverings for the next 2 months and create a situation where the virus cannot find a host, you could probably eradicate the virus. That is subject to test, but it's something well worth considering, because we haven't yet found the animal host, and even when it does, if the animal host isn't as globally distributed geographically, then COVID-19 may well be the next virus that we can honestly apply efforts to eradicating.
Well, Doctor, we're talking about white polio. But the reports celebrating the fact that white polio has been eliminated in Africa also said, well, we should jubilate with caution, because there is a case of what is called vaccine-induced polio in 16 reported African countries. So what's the difference between white polio and vaccine-induced polio? Because you'll recall the controversy about polio vaccination in the northern parts of the country, when some leaders of thought and community leaders insisted that the vaccination would, in fact, will have negative impact on their children rather than a positive one. Could they have been talking about this vaccine-induced polio? And how can vaccine-induce polio?
Well, they weren't talking about the same thing, in fairness. I mean, at that time when there was a pushback to vaccinating children against polio, it was more related to the debacle of the Trovan that had occurred earlier, and people just not understanding what this was all about. But that was quickly sorted out, because at the end of the day, this is what I mean about health promoters and health educators going door to door. People need to hear a true message from people whom they trust. And it is the message they hear from the people they trust that they are going to adhere to. On the other side, on the science side of it, the circulating vaccine-derived polio virus is a virus or the disease came because if you use the polio vaccine is what we call an attenuated vaccine. So if the immune response was not strong enough, if a child got the vaccine and the immune response mounted in the child's body was not strong enough, the child was able to excrete semi-active viral particles, which could then go on to infect children who were not immunized. In fact, we had a case of that. I think last year we had a case in Lagos, in Mushi and in Shomolu, which was met with a rapid response of widespread mass immunization of all the children under 5 in all the local governments in Lagos, but particularly in Mushi and Shomolu, and we were a part of that because, of course, Lagos University Teaching Hospital is in Mushi. And that has now been countered by giving 2 other kinds of vaccines that don't provoke the circulating vaccine-derived poliovirus. I hope that was a simple enough explanation. It can be a bit complicated sometimes.
Yeah.
Okay, let's talk more about vaccination and its acceptance, because you know, some would say why it took so long, decades, to eradicate polio was because of that suspicion around vaccination. With COVID-19, do you foresee this also being a challenge when it comes to vaccination and its acceptance? I mean, in other climes, we are seeing increasing agitation by anti-vaccination groups who say, you know, we are not going to take this when one is eventually developed and approved. What do you foresee happening in Nigeria?
It's a very difficult question to ask. Vaccine hesitancy, anti-vaccine campaign groups, it's a function of freedom of will, freedom of choice, and, you know, sadly also a function of education. Now, personally, I have quite a few issues with it, because if I decide not to take a vaccine, I'm an adult, I can look at all the information and make an informed choice. But how does a baby decide? And if somebody does decide for that baby, because I read the story of a father you know, who had 3 children immunized, and then the last child was born, and for some reason he had changed his mind and he absolutely refused the vaccine, refused immunization, and the child was not immunized, and then goes ahead and develops polio. And now polio is a really nasty disease because you develop it and you are guaranteed a lifetime of pain, discomfort, and disability at varying levels. So when these things are being put out, if you're taking a decision for yourself as an adult, okay, it's freedom of choice. I don't have to agree with you, but it's your choice. But the problem is going to be with the children, the under 5s, not giving them a chance at the very best quality of life that they can get. And it all boils down to, again, education. You see, when you're trying to talk to people who have no frame of reference to understand the biology of disease causation, it's very difficult to get them to agree to accept a vaccine if they've heard a rumor that this vaccine is going to A, lead to infertility, or B, lead to some other dangerous sequelae. So this issue of vaccine hesitancy and anti-vaccine campaigns is a very, very serious issue, and one that really can only be dealt with adequately by mass education and constant reinforcing the messages of what can happen. And in some cases, a degree of sanctioning, I guess.
Well, Doctor, in the course of this conversation, you must have referred to primary health care about 4 times and how important intervention at that level is important. But we'll see that the last time Nigeria took primary health care really seriously at the policy level was probably in the days of Professor Olikoye Ransom Kuti as Minister of Health. Now, what should the federal government and the state governments be doing, health being on the concurrent list? What can we do to make sure that the people in the rural areas, in many of the inaccessible parts of Nigeria, have access to affordable health care at the primary health care level? And do you think that these state governments that are dealing with issues of viability, resource management, would consider primary health care a priority beyond the advocacy that people like you put up?
You are very correct, and the late great Professor Olikoye Ransom Kuti was my teacher, and hence, that's partly the reason why I'm where I am today. It is vitally important. It's very difficult that health remains on the concurrent list, because what then happens is that primary health care, the most important level of health care, is given to the weakest arm of government, local government. And because of the way our finances are handled and the resources are distributed, because every local government chairman has a right to access the funding for the local government that he is in charge of, or she is in charge of, and deploy it as and how he or she pleases. And this affects primary health care and affects primary education. The two things that are critical to ensuring that we bring up Nigerians who are well equipped to develop the nation. It's something we really do have to look into. Presently, in the short term, is a huge opportunity, like we keep saying, for public-private partnerships, because this is something that certainly the private sector, with its accountability, monitoring, evaluation, everything that they have, can, if the state governments are willing, can do critically. I know that there's a foundation working right now to work with primary healthcare centers in a state to strengthen them, to equip them, to staff them, to monitor them, and to set in place funding and financing innovations that allow the community to get the very best. It's worked in Kwara State, for example, the Shonga, the Emir of Shonga at that time, and his community-based health insurance scheme. So there are things like that that can be leveraged on, that can be copied, that can be monitored, that can be used as proofs of concept to strengthen the primary health care sector. Did I only mention it 4 times? Can I mention it a couple more times?
Oh, yes, yes.
Because it is the most important level of service, health service delivery that we have. And we can do so much at the primary care level. We can take care of mental health. We can take care of oral health care. We can take care of course, antenatal service, children, growth and monitoring. We can take care of adolescents, giving them skills and drills that can strengthen them to become fully fledged, fully potentiated adults. We need all this.
Indeed. Let me just ask you this question regarding vaccines and availability of vaccines. Can we maintain this feat when we largely still depend, when we depend solely on vaccines from international aid and donors? What would be the message around availability of vaccines?
We cannot continue like this. It's another opportunity for investments that can yield huge benefits for the country. We are 200 million strong. We are not a small country. We are not at this stage, almost 60 years of independence, supposed to be depending on donor aid and countries. I mean, when that type C meningitis hit us, and we were at the back of the queue to buy the vaccine needed to immunize the children, that should have been a wake-up call for us, that we really have to look seriously into the business and into the industry of vaccine development and vaccine production. It's not a small. It's not a small thing. It's hugely. What's the word I'm looking for? You know, it consumes a lot of resources, but it can be done. It's very capital intensive, but it can be done. We should be the place, we should be the place producing vaccines for the whole of the West African sub-region, if not much of sub-Saharan Africa. They can be coming from Nigeria. It'll make transportation easier. It'll make distribution so much easier. And it's something that we really do need to look into very critically. It's about time.
Well, thank you very much, Dr. Roberts, for joining us this morning on The Morning Show. Thank you very much indeed.